All right, so as I promised, we are going to go over the Congressional Budget Office's analysis of the AHA, that is the American Health Care Act, or the answer to Trump or Obamacare. So we'll call it TrumpCare. It's only fitting, right? Well, you could also call it Ryan Care because Paul Ryan pretty much wrote and championed this thing and has been cheerleading it on cable news for the last few days, trying desperately to gain support for it so it will pass in the House and hopefully, well, not hopefully, but he hopes in the Senate as well. So the Hill reports here 24 million more uninsured under GOP bill over a decade. Oh boy. The Congressional Budget Office on Monday projected that the number of uninsured people would grow by 14 million people in 2018. So in 1 year, we're going to double the amount of uninsured people we have. Right now, it's about 10 to 14 million people, even though under Obamacare, we had the individual mandate, which meant that people have to buy private insurance or risk penalty or fine, although there was no enforcement mechanism for this. So essentially, you're breaking the law, but you're not really going to get in trouble under Obamacare if you didn't have insurance. But that number will grow to 24 million in a decade. So in 1 decade, we're going from 10 million people roughly uninsured, and it was before Obama took office, under George Bush, about 20 million people, so Obamacare cut that in half. And now we're going to see that double in 1 year. The long-awaited analysis from the nonpartisan Congressional Scorekeeper is likely to shake up debate in Congress over the measure, which could come up for vote in the House next week. The report finds that 24 million people would become uninsured by 2026, largely due to proposed changes in Medicaid. The bill both ends the extra federal funds for the expansion of Medicaid and caps overall federal spending for the program, both of which the CBO says would likely lead people to losing coverage. The report finds 7 million fewer people would be insured through their employers by 2026. So now a lot of people are insured through their employers, my dad being one of them. It is great for those who have it and it works for them. But for a majority of people, we're not getting the best benefits from our employers. Our employers aren't going to be incentivized to give us the best health care they can because companies and corporations are designed to make money. And while we're on that note, let's not forget that private healthcare insurance is a for-profit business and it only exists in the good old US of A. Every other modern nation has a single-payer Medicaid for all system or a single-payer healthcare system. Premiums in the individual market for health insurance would increase before 2020 and decrease after that, according to the report. The out-of-pocket costs, including deductibles, would tend to be higher under the GOP bill than Obamacare because of loosening requirements on insurers. High deductibles have been one of the GOP's main lines of attack against Obamacare. The report also notes that the financial assistance for low-income people under Obamacare to help them pay for their deductibles would be repealed. All right, we got a little bit more to read, and we'll talk about it. The legislation would decrease the federal deficit by $337 billion over the 2017 to 2026 period, mostly through the elimination of Obamacare's individual mandate. Under Obamacare's Medicaid expansion and the law's subsidies to help poor people buy insurance. So, under Obamacare, it was designed to where everybody would at least be able to afford some kind of health care, even though for especially low-income workers, it could cost a lot of their monthly salary. Actually, under this new bill, it could cost people up to half of their salary. Low-income, blue-collar workers, half of their monthly salary for health care alone. And to put that in context, most people these days are paying more for rent in their house than they make. So, like, they're paying over 50% in rent. So, let's just do the logic here. you're paying half your money to rent, half it to healthcare. You're broke. You have no money to spend on groceries, any other essentials, and that's just getting started. So who is this for? Like, that's everybody's question right now. It's like, who is this helping? It's not expanding care to anybody. It's not making it cheaper for anybody, unless you're talking about in 2020, when younger people will begin to see less of a or a smaller deductible, while older people who need health insurance more and rely on it more will see it rise about the same amount. So about 20 to 25% will decrease for younger people. Older people will have to pay more. And as we all know, all of our grandparents who use Medicaid and Medicare and live modestly can afford all these expensive medical procedures that go along with cancer diagnoses, heart failure, diabetes. No, millions of people or lives are at stake here. This isn't hyperbole, this isn't a joke. Hundreds of thousands of people will die if this becomes the law. When you have 26 million people uninsured, that means 26 million people don't have access to health care. How can we say we are the greatest nation on earth if we can't even provide health care to our people? If you're going to make the argument that the government shouldn't be paying for your health care, maybe you should think about what the government is there for in the first place. It's to provide the citizens with services that we pay into with the expectation that we will receive the benefits from them. And under this administration, not only is our healthcare in danger, in order to make up for the $54 billion increase in our military budget, Trump is going to almost every single federal agency and cutting to make up for the difference. So now we know that the EPA, the National Oceanic, NOAA, I don't know the rest of the name, the weather services are going to be losing funding. Science is basically not even a real debatable issue to Republicans. So anything to do with science, you can pretty much kiss about 30% of their budget goodbye. People in the EPA right now are scared. They're, literally making copies of documents so that they can be there and to show that they had this information, because the Trump administration's actually trying to get rid of it. And I'm not saying Donald Trump himself, but those he has appointed. When you have people like Scott Pruitt, who's now running the EPA, who tried to sue the EPA 14 times before becoming the head of it. Like, you see any kind of conflict of interest there? Any reason why that might not be the best for you or me? All right, so anyways, I know this has dragged on for a while, so I'm just going to read out some bullet points and give you guys some ideas of what else this is impacting. The provision will result in several thousand births in the Medicaid program and increase spending for Medicaid by $21 million in 2017 and by $77 million over the 2017 to 2026 period, the report found. So how is this fiscally conservative? It's not. This isn't a way to help us save money. This is not a way to help expand care, when it literally does the opposite. It charges the average American more and makes access to healthcare harder and punishes those who don't buy into healthcare programs by charging them 30% higher on their premiums if they haven't been paying their health insurance for the last 2 months. The GOP plan, if enacted, would defund Planned Parenthood for a year. So all of the free services that Planned Parenthood provides across the country, free cervical cancer screening, breast cancer screenings. They also provide contraceptives, countless STD prevention, birth control, I mean, all these great services they provide are free to the public, free for people who can't afford them. And they're just going to cut that out because they're against abortions. Well, Planned Parenthood does 3% of their business, if you want to call it business, in abortion. And guess what? They cannot use a single taxpayer dime on abortions. Read Roe versus Wade. Planned Parenthood is just a place where if you're going to get an abortion, you can go and get one safely. Republicans are trying to take away everything that gives you the opportunity to express your right under the Constitution to have an abortion if it's in the legal time period. Hold on just a sec. Get out of here. Sorry, my cat was making noise. So anyways, I forgot where I was, but I'm just going to end this long-ass video by saying that who's benefiting from this? I'm going to sound like Bernie Sanders. The top 1%. They are getting $600 billion in tax breaks. $600 billion. If you make over $3 million a year, which would put you in the top tax bracket, you're saving hundreds of thousands of dollars a year on healthcare, and everybody else is going to be missing out that $600 billion. Would you cut it out? I'm trying to make an important video here. So anyways, that's it for now, and I will be back if anything new develops. And like I said, this probably won't get passed, so I mean, stay vigilant. Let's hope it doesn't, but there is still a chance that this could be our healthcare plan, and we all need to write our senators, our representatives, call them, do whatever you can to let them know that you're not for this and that you want a single payer, Medicaid for all system. No private insurance. They cannot make a profit off of you. They don't have to look out for the investment or their investors instead of their patients. This is the 21st century, and it's time we start acting like it.